guess I wait till Alexis gets back. Hello. We okay. While we're waiting on Alexis to come, we have a young lady. What's your name? Leah. What's your last name, Leah? Huh? Franny? Leah Franny wants to do a quick speech until her mama comes, okay? Can we give her yeah, I think a round of applause. Now you got 1 minute to do your speech.
Hi, guys. I wanted to say that every single one of y'all that are in here today are special. And I know I'm kind of shy, but I wanted to say for thank you for coming and joining us. And I wanted to say have a great day.
She did so awesome. Please. Thank you so much. She practiced her speech all morning. Oh, we don't have everybody. Aiden, would you like to say anything? Okay. This is Aiden. This is Leah's brother. So here you go.
My mom very welcomed y'all to be here. Like, she, worked her butt off. I mean, for real. It took, a couple of weeks doing this, in my opinion. I mean, I'm not sure, but, I'm just saying. That was a lot.
So those beautiful children were birthed by Alexis over there. And you can see that all her hard work has not really impacted them because they're so joyful. They're stress-free. Yes, so they have the energy and the joy. I know that's right. Because mama didn't work hard. That's what they said. Okay, we get started. Before we get started, how was lunch? It was really good. There was something amazing that happened on Monday. Does anybody remember what happened Monday, this past Monday? The eclipse. For those of who are in tune, I love the whole energy around the eclipse. And I was thinking about why Dr. Mitchell was talking. She gave us history. She gave us words of empowerment, inspiration. And I always say that eclipse for me, what it meant for me, that we're disrupting systems. So I think it's a very prophetic and divine moment that we're here because this is about disrupting systems and really getting back to alignment to who we are. And it's only someone that's higher than us, whether it's a he, she, or anybody, is the one. That power is bringing us together today. So I really want to say thank y'all for being here. Are we ready? I hope I can, I have tech help too. So we are about to start the Spark Chat Policy, Activism, and Advocacy in the Maternal Health Space with Marie Mott.
Thank you for getting my name correct.
Oh, did I? Okay, good. Councilwoman Amelia Parker. And then we have Alexis. And Famika is over here being my tech person. But before we really get started, we have some words from Senator London Lamar and Senator Becky Massey.
Hello. Hello, everyone. My name is Senator London Lamar, and I proudly represent Senate District 33 in Memphis, Tennessee. I stand before you today as not just a senator, but as a voice for the voiceless, a champion for the marginalized, and a fierce advocate for change. Maternal health isn't merely a policy agenda for me. It's a burning passion that cruises through my veins. And as a Black mother nurturing a precious 7-month-old son, I know firsthand the joys and the struggles of motherhood. But I also carry the weight of loss, having witnessed the tragic circumstances and neglect of inadequate care that cost the life of my first child. This isn't just statistics or rhetoric. It's the harsh reality that far too many mothers face, particularly women of color. The disparities in maternal mortality rates are an indictment of our system that fails to prioritize the well-being of all mothers. African American women are dying at alarming rates compared to their white counterparts, and Tennessee finds itself shamefully ranked in the top 10 states with the highest maternal and mortality rates. Please let me be clear. This is not a fate that we must accept. It's a call to arms and a rallying cry for action. Throughout my tenure in office, I've fought tooth and nail to enact meaningful legislation. I've championed legislation to recognize the invaluable roles of doulas, to ensure pregnant college students can still pursue their education without sacrificing their scholarships, and to elevate the voices of community-based organizations in tackling maternal health crises. I've spearheaded the establishment of a maternal health caucus because this issue demands bipartisan collaboration and unwavering dedication. But our work is far from over. We must confront the harsh realities still facing women who are denied the right to make choices about their bodies. I've stood tall in the face of opposition to reinstate abortion rights because I refuse to let politics dictate the fate of women's lives. Every woman deserves the autonomy to make decisions about their own health and future. My friends, the journey ahead may be daunting, but I am dedicated in my commitment to this cause. Together, we can ignite a spark of change that will echo not only throughout Tennessee, but throughout the nation. Let us be architects of a future where every mother, regardless of her race or circumstances, can experience the joys of childbirth without fear or tragedy. I hope you all have a great conference, and thank you so much. Hello, everyone. My name is...
Hello, I am State Senator Becky Massey, and I am here today to talk to you about the importance of policy, activism, and advocacy for maternal health. In Tennessee, there are over 210,000 women that have limited or no access to maternity health care in their counties. This can cause many issues to arise if the mothers are unable to make the longer drive to another county or take the extra time off of work to receive the necessary prenatal care. This high number of expectant women who are unable to receive the proper prenatal care they need contribute to 11% of babies born in Tennessee being premature compared to the national average of being only 10.4%. This ongoing problem across the state needs to be addressed. That is why I sponsored and passed Senate Bill 1674 this session, which will allow an expectant mother to use teleobstetrics if they do not live near a doctor or are unable to make their appointments due to other circumstances. Maternal health is a very important issue, and there are many more improvements needed before Tennessee can fully support mothers. Thank you for participating in this conference and doing your part to learn more about maternal health. Together, we can improve maternal health for all women in Tennessee.
Thank you. give up to Senator London Lamar and Senator Becky Massey for doing the work. So you already know Famika and Alexis, but I'm going to take a time just to do a quick introduction for Amelia Park. Yeah, quick. Can I, well, you know what? Can you want to do a quick one? Because I want you to highlight your greatness.
Well, it'll be quicker than that.
Okay, go ahead.
But the bio that they have for me is really long, so I was like, oh, Lord, are they about to read my whole life story? Not really necessary, but good afternoon, everyone. Good to see you all. I am a member of the Knoxville City Council as an at-large representative. That means I'm a citywide representative. And I'm now in my second term. I grew up here in Knoxville, graduated from the high schools here in Knoxville, went on to get my law degree before coming back to Knoxville, where I wanted to organize in my community for some serious social changes. And it was quickly clear that we needed a inside and an outside game, essentially. So we formed, me and several community members who were active here in the city of Knoxville, formed the city council movement to recruit individuals to run for local office, and then, you know, hopefully we'll have our eyes set on other levels of government at another point. But right now we're focused on shifting things here in our city. So hoping everyone here today who's a resident of the city of Knoxville is a registered voter and willing to get engaged and help us make some positive change here in the city of Knoxville. Thank you.
Thank you.
That's all I got.
Marie.
Oh, you want? Okay. Good afternoon, everyone. My name is Marie Mott. I'm from Chattanooga, so I'm very privileged to be here. I am the middle of 3 children. My mother is a chemist, now project manager, and my father is former military and law enforcement. So I came up in a community that believed in serving one another, as that's our rent that we pay every day for room on this earth. And I am a community activist. I am a graduate of Harvard Kennedy School for public policy and government. And so my preferred specialty is breaking through the glass ceiling that is the institution of government. And if you cannot do that on the inside, then why not write the public policies and bully the elected officials to pass them? So that's currently what I'm doing with these beautiful sisters right here, is putting our elected officials in a chokehold and holding a gun to their head and telling them they need to do things for us.
Not a million, not a million.
But not in a real way. But
And she means that with love and justice and grace in mind. Well, sometimes you may have to start a little war, but as long as it's not rooted in hate, it's okay to start wars. At least that's what I tell myself. Are we ready to get started, ladies? Okay. Question number 1. Why is focusing on women's and maternal health so vital to ending poverty? Who's going to take that one?
hey, you push me out to the forefront.
Okay.
Well, in my city, the poorest in our city are children. 1 in 4 Chattanooga children are in poverty, but they're in poverty with their mothers. And so in order to end poverty, you have to invest in women. And that starts with investing in Black women. And I'm unapologetic in saying that. And we have been championing movement for so long, and yet the cries that we have around, whether it's fair pay, whether it's adequate housing, transportation, what we often find is kind of the discussion that was on the panel before, or what you were talking about, is that most of what we hear in terms of how decisions are made from public policy, which is supposed to impact poverty, is being discussed amongst middle-aged to old white males who have, if they have interacted with a Black woman, it's been a Black woman who has cleaned their house like my grandmother did as a domestic worker, or raised them while their parents went to work. And so until you have this intersection of public policy that really is digging into diverting resources. Because when we think about a city has a budget, and they have two, right? They have a general budget and then a capital budget that invests in infrastructure and needs in a community. So not only can you have jobs and can you have economic security from a general budget, but then from that capital budget, you could come back in as a city, and they do it through several ways. They call them TIFs, tax incremental financing districts. They call them bonds, where a city will take on debt to be able to invest in certain projects. And why are those projects things like, I'm gonna try not to cuss, okay?
Cussing is okay here.
A fucking stadium. No, for real. We have multiple stadiums that are going up across the state off the backs of the taxpayers at the same time, where it's just hard to get around a city like Chattanooga, where it's a privilege to have a car. Because everything in terms of access of your job is 20 minutes away from where you live. And if you don't have a car, you can't get around. So when I think about the intersection, it is we need people from the outside to challenge the people on the inside. And if those people are not going to get on board, then we need to start movements to be able to vote those folks out.
Well, there you have it. Thank you. What are some of the ways, I thought y'all said, what are some of the ways maternal and child health is jeopardized in Tennessee?
I mean, so many ways. I can start it and then y'all fill it in, because I'm going to start with the obvious ones. Lack of access to health care, not expanding Medicaid, not having less funds available for needed services in our community. That is particular to the state of Tennessee. I think understanding what harmful pieces of legislation are being passed through our state government each year that impacts women's health. So many ways that we're negatively impacted in this state. Who wants to add into that?
Anybody from the audience? Or
I
anybody
mean,
up
I
here?
would say access completely, like you said. I know that actively now the policy that we have been pushing for state of Tennessee as a whole is to bring grassroots organizations, those community-based organizations who are also in the sorrows in those rural counties, who are doing a lot of trench work to actually be able to help bridge the gaps of accessibility when we talk about that too. So, yeah.
Awesome. Anybody from the audience they want to share? Okay. How does misinformation prevent women from accessing care, and how can we work with the faith community to address misconceptions that keep women from getting care? Who wants to take that? You said.
I'm not answering that question. that's not my wheelhouse. I'm just letting you know. Yeah.
You want? Okay, I'll do another question. Yeah. Okay. Did I say how does investing in maternal and child health help kids stay healthy? Okay.
So we know that children, often take behaviors, model behaviors from their parents. So myself as a food practitioner and food educator, it's very important to me to not only nurture moms through food, but also restore power back to them and take advantage in a hold of their health. And so I believe that when I start with the mother, the father, that it trickles down and matriculates to the family dynamic, encouraging kids to make better food choices, whether it's in school, it's outside of school, just personal experience. When I formed the Lotus program, I had 3 clients. One actually was a returning client. It was my cousin, actually. And she really wasn't well-versed in how to utilize her SNAP or WIC benefits, didn't have no idea that the Doubling Up program or that the farmers market even, accepted WIC and EBT and SNAP. And so ever since then, and you know, she knows about that, but she also knows how to cook for herself, like healthy meals for herself, and her kids. Her kids are now officially kicking and screaming out of the farmers markets, like not wanting to leave. And so that's really important, and I believe that you have to operate from a holistic standpoint when we talk about health, but not only nutrition, but just period, health period. If we're not operating from a holistic view and addressing the social determinants of health, those legs of those tables, like the legs of the table will fall. So you can't just address one thing. So like most of the time when we look at legislation or talk with people in the birth community, it's like one thing is addressed, right? It's conception, pregnancy, maybe postpartum a little bit, but as you all heard earlier, most of these fatalities and casualties are happening between 30 and 365 days postpartum. So it's my duty to educate on all of the aspects, especially when it comes to food, health, and wellness.
Thank you so
cover it?
much. Yes. So I got one last question because I know it's a smart chat, and it didn't come from here. It's coming from my mind, so forgive me. What are the mothers saying from their perspective? You're all sitting on this side of advocacy and activism and policy, but what is the community saying about the maternal health space? Do they feel valued? Do they feel supported? What are the words you're hearing, the phrases that you are hearing with regarding to maternal health?
Well, as a local legislator, I'll tell you, even on city council, we're hearing from doctors in our own community who have real concerns working now in the state of Tennessee and providing maternal health care, you know, within the reality of our new state law banning abortion and what is considered abortion and what is considered reproductive health care, according to our state. So I'm definitely hearing those real complaints. Also at a local level, what we often might not think about is location of services. So how long do I have to travel to get to services? And a lot of that comes down to zoning. And I wish I could find a way to make zoning sexy so we could get more people engaged in these zoning conversations, right? But, you know, oftentimes when we're talking about, we had a conversation in Knoxville recently about zoning involving social services and where do we want to see social services in our city. We have a new zoning structure that allows for neighborhood commercial. That means, for those who are familiar, I'll just say a random neighborhood because a lot of people aren't from Knoxville, but if you go into a neighborhood and it's mostly residential, but you might drive into the middle of the neighborhood and there's a little park and there's a little neighborhood store. Well, some neighborhoods would love to have, you know, some local health services available there and, you know, some other resources. But then there are other parts of our community who say, no, we don't want that because what about the uninsured people who are going to come and seek out those services? Or what about, you know, the days that they're opening up those services to those who are unhoused, and then they're all going to be traipsing through our neighborhood. And then it turns into those types of conversations, right? But to have these healthy neighborhoods that we truly all want, we've got to be involved in these zoning discussions so that we do allow some of these services into our community so we don't have to drive so far to get to them.
I guess I'll just tap in, and then I would like Alexis to come after me and fill in the gaps. So with the zoning, I think we also have to remember that zoning and all the things like that associated with government, most of the time is strategic, right? And it's for, you know, to decrease access to certain things. When we talk about marginalized communities, if you've never read The Color of Law, you definitely should. If you've never heard about food apartheid, medical deserts, like that's real, and sometimes, most of the times, cities will intentionally create policies and zoning laws to dismantle specific communities, okay? And so I'm just gonna keep it a buck today. I don't know how to filter things most of the time. And so I'm not a doula on paper, but due to the lack of integrity that exists within the Knoxville birthing community, I have had to answer the call to be a backup doula in support for my sister over here. And that should not have happened that way, right? However, so that's another thing. There's mothers that have personally come to me just because I work closely with Alexis, and they think that I'm a doula, and they're asking me to provide them with care. If you know anything about what's happening with our local hospitals here, most of them now have said, hey, sorry, you got to provide a certificate, you got to come to this class, you got to X, Y, and Z. And so people like me that community trusts, that's a community pillar, unfortunately, I have to wait outside of the hospital until it's time to really, I guess, activate my activism role, you know, and then sometimes it just is what it is, okay? I'll take the repercussions later. And so, you know, things like that happen, sometimes they don't want us in these spaces just because of how we amplify the Black woman, the Black family, but we amplify all families, period, across the board. And just being transparent, there's a lot of people that want to water down our work, and that will never happen. And so it doesn't matter whether you're Caucasian, Black, it doesn't matter. We're here to advocate for all women. So policy that we made, SB 1832, shout out to Marie Mott, okay? House Bill 2226, okay, sponsored by Representative Love. We co-created that with community. We had 3 community convenings where community members, birth workers could come in and tell us, what would you like for this policy to look like? So it wasn't just Alexis and I effort. This was very open to community. We could not do it without community. Thank you so much for those that helped, that were there. Lizzie, shout out to you because you was there. Thank you, girl. And so, you know, it's just things like that that's really important, especially when you're making policy, because that's how community truly gets behind you even more, because they have a stake in it, they have a voice, and, you know, we work for the people, period. We don't get paid to lobby. It is very stressful. Most people do, but we don't, okay? We got 2 and 3 jobs. Sometimes they would call us like 2 hours before a session, like, hey, can y'all come? I'm like, we're birth workers. And I'm a farmer. What do you mean come up here in 2 hours? Like, you know, so it's just stuff like that. But I would just say, like, I'm going to make a charge to birth workers, to community-based organizations, because if you want to bridge this gap, we have to collaborate, and you cannot operate from ego or a space of ill intent. Regardless what your personal vendettas are we here for one common goal, to be sure that women and families and children have adequate care or not? Because if you're not in alignment and if you're not operating in integrity, we're going to be the ones to let you know that you're not. Because 9 times out of 10, it's your clients coming to us reporting. And I don't know if y'all saw, but there's a table on there, Earth, taking the B out of bias. That is like a birth worker and hospital review, like Yelp, for the birthwork, maternal health, child care, like industrial complex. So we've been telling moms, write your reviews on your birth workers, even us. Take what we say with a grain of salt, but it's really important. So I implore you to utilize that resource as well. But just also know that activism is not nice. Advocacy and also advocacy and activism, they're alike, but they're different in a way. And so, like, you know, when you see us amplifying voices, or whether you want to say calling out, it's really important to know that it's just a level of accountability that community deserves, okay, that we should not ask for. It should be off rip. If you're in birth work, period, no matter what silo you're in, you have that duty. You took an oath, whether you realize it or not, inside or outside of the hospital. So that's all I'll say about that. Lexus, you
I feel like you didn't shut it down.
what did the mom saying?
So a lot of things that I get from families and mothers is the lack of professional care. And when I say professionalism care is, okay, hey, I'm getting care from so-and-so, and I don't know all my options. I don't feel educated. I don't feel like I have access to all the things that I need to know. And so I do get that a lot of times. I get a lot of my clients from community, all community referrals. I always get my clients from a mom that done told a friend or an auntie or someone who just seen me like, oh, I know about you, but I've never met you in person. So I think it's really, for the state of Tennessee as a whole, is the lack of resource being in one pool. And when I say the lack of resource being in one pool is it's scattered, it's stagnated. People that's in Sevier County, I've served outer counties, Scott County, they don't have nothing at all. They're driving an hour or so just to get prenatal care. And so they're even more like, I don't have nothing at all, and like you are a blessing that you are my doula, or I have care under you, because they were like, I did not know none of this. And so those are the things that I really hear. I do listen to the people I serve. I listen to community. Last year for the convening, we put a call like, hey, we will be pushing policy. We're going to legislation. When we make the call, show up. And we made the call, nobody really showed up. We are still sticking here, pushing policy to this day. And I do want to shout out to Berie, because she's been the biggest support. And you are all the way in Chattanooga. And so I just really think that what our call is for us to really unify, because these convenings is important. And yes, we want to give valuable information to families and care providers who are serving our area and surrounding counties, but we also want to actually see actionable change. And the only way that can do that, it cannot just be 2 people or a few people that's gonna make that happen. It has to be more than us. We cannot do it all. We cannot. So that's really what I wanna add.
What these ladies are eloquently saying is that they need a movement which requires people and diverse skill sets. What I'm seeing on the ground in Chattanooga is somewhat of the same, but I don't want to leave out some of the good that's coming out of this moment, which is I'm seeing so many Black women who are taking up the responsibility in the community of becoming doulas. And we have one woman who has been on my radio show since 2018, Miss Monique Weeks, who's going to be our first African-American midwife in Chattanooga. And I told her, I said, I'm waiting to have a baby for you.
That's me. That's me.
And I say that because I buried one of my best friends since high school. I'm 36 years old. Last year, 2 days after she gave birth, she died in the hospital. And in particular, her husband was really tussling with doctors about pain and different things that she was experiencing, and is currently suing the hospital for malpractice. So I felt it was a divine intervention, because I'm one of those persons where I don't like being frustrated without that energy being able to go somewhere. So when we had an opportunity to come in, it wasn't originally for maternal health. We just had a community conversation, and all of the people who were in this group were supposed to follow up with public policy with me. And only 2 people did, and they're the people that are right here on this panel. And we've been hashing out and going back and forth and doing Zooms and calls and pull-ups and adapting to last-minute conversations from elected officials who have staff. But what these women don't know is that there would be so many times I would get off of the phone and I would take a deep breath and I would be like, thank God that there are women, even who are not in my city, who are doing the work and that it's not being left undone. And that is amazing. And so if you are a person that is doing the work in this room, please do not leave this place and leave these women for another 364 days until they come to next year's symposium to try to motivate you to get involved. And as Councilwoman Parker is saying, I hate to say it, we've got to learn how to do some boring work. Public policy is boring, so make it fun and do a wind down when you're doing public.
But it gets interesting on the Hill.
It does get interesting on the Hill, and what you will begin to see the more that you get involved is, I've gotten this for almost 10 years of being a community activist. Marie, we see you, but where's your community? And when the community shows up, they are blown away because they don't expect you to get engaged. As a matter of fact, they're hoping you stay home so that they don't have to give you anything. And so we know that Frederick Douglass said, power concedes nothing without a demand. It never has and it never will. You won't get anything out of this system unless you demand it. And I don't know about anybody else. I'm not going to ask for what's rightfully mine. I'm going to knock on your door. You're going to give it to me.
Period. I just want to say, lastly, there's different ways to get involved, right, in legislation in this movement, period. So, if you are, you're not interested in being a registered lobbyist, you can still capacity build with us. So sometimes it's just like, come to the convenings and tell me what your clients or what the silos of your birth community is asking you for. That way we can build it in policy and co-create together and take it up to the Hill next session, right? It can look something like sending gas money, sending food money, okay? Thank you, Kimberly. Yes, thank you. Yes, thank you. So stuff like that. So don't think that, I have to be a registered lobbyist. I have to be on the Hill. No, you do not. There's a lot of behind-the-scenes stuff that y'all have no idea, where we need help. Like, it's a lot of heavy free lifting, okay? And so don't think that just because I'm not a registered lobbyist, I cannot do nothing. Absolutely not. There's tons of ways that you could get involved in policy. And even if it's just signing the petition, okay, signing petitions, that helps, okay? Doing a letter of support when we go and talk to these so the Tennessee Department of Health and the Health and Welfare Committee, they're all Caucasian males except for one. Senator Massey, and she's our senator of Knoxville. Okay, so just keep that in mind. Talking about women's bodies. Okay, but we'll go into that later. But I just want to say, don't think that you do not have a role or responsibility just because you're not a birth worker and just because you're not aware about policy or you're not a registered lobbyist, okay? Thank you. We need y'all help.
Give it up. It's about collaboration. It's not about competition. Our community is waiting on us. Everyone in this room are trailblazers because you're here. Use that voice, use your power, your divine power to transform communities. Now it's time. Are you about to tell me something? Okay. I want to make sure I'm obedient because sometimes I can be a little disobedient. So we about to do the breakout sessions. So there's 2 tracks. There's the Advocacy, Activism, and Justice track. And that's breakout session 1, Remembering You, Remembering Us with Courtney Clardy that you heard from her earlier. That is a support group. and that's in room 130. I wish I can explain. 130 is like on the back side, turn right, make another right at where like you're going to the library. Don't you hate that? You don't have the street signs, but y'all know how it go, how you describe, like if you take a right by here and go left to there, there's the right. But it's always in the back of the school, and I'm sure there's volunteers out there that can lead the way. But that's in room 130. And then you have breakout session number 2, implicit bias for birth workers with Zev, and that is room 126, and that's on the back side. See, don't listen to me because I'm gonna send you to the wrong place then. And then the village track, empowering your birthing journey, forming your birth team and beyond, is with Juan Irby. That is 160, and I think it's down this hallway, right? Okay, getting there. And then a pilot program between Cherokee Health Systems and Central Hispano with Christina is room 124. So those are the the 4 sessions. They're happening all at one time. So get to your session and enjoy your day. And we'll be back here for Spark Chat number 2 at what time?
2 o'clock.
2 o'clock.
Well, let's do
2:10 or 2.
Hold on. No, 2 o'clock. 2 o'clock. Don't forget, we have a stand and repeat photo booth. So find the photographer. We have other photographer that's doing professional headshot minis in the back as well. We also have a veggie meter testing with the UT Department of Nutrition. The Black Maternal Health Art Gallery is on this side as well. So you do not have to attend a breakout session if you don't want to. There's a lot of things for you all to do. The kids' corner is also to the this side of the building, all the way at the hall. Please shop with your vendors. Please tip our licensed massage therapist. She is very well versed also in prenatal and womb massage, scar tissue massage. She'll be doing a demo later, but please, 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 please tip her, okay? Yes, thank you. I'll see y'all back at 2 o'clock.
Spark session, so please come. Tap, tap. Oh, you got it. Is everybody tired? Everybody, clap your hands real quick. Yay, come on. I will, I should play some Beyonce, but I understand everybody's not a Beyonce fan, so I keep that to myself. Did I talk about these sponsors before lunch? Because I don't remember. But this is sponsors for lunch. Yes, because we talked about how great lunch is. Okay, let's get started before I get off schedule. So welcome to Spark Chat number 2, Amplifying Moms of Color Through a White Lens. We have Kimberly Pettigrew, yay, and Erin Rose. Before we get started, y'all have amazing bios. Here they are. But I want y'all to introduce yourself. I think it's easier if y'all just want to highlight what you do. There's a mic beside you, Erin.
Okay. And will you turn the light off?
Yeah,
Do we
she's
need
going to turn the light
screen.
Yeah.
Oops.
So after you both introduce yourselves, I'm going to ask you a few questions. Let me get the party started.
I'll go first. Okay, I'll go first. Hi, I'm Erin Rose. I work for a research nonprofit that I co-founded here in Knoxville called 3 Cubed. We have a mission to foster equitable and sustainable futures. I have backgrounds in social work and international human rights law. And I do national research, regional research, but my heart is in this local research where we look across systems from housing and energy and health equity, and we help organizations and communities here draw connections between them and really center our work in community-driven processes and systems thinking.
Thank you.
Hi, I'm Kimberly Pettigrew. I'm currently employed by the United Way to do food systems work, but my background is in applied community development, and so it's all about harnessing grassroots change and then working with top-down decision makers and outside-in innovation. So it's really community-owned processes for building a better future rather than me doing the work for the community does the work, and I support them. So, yeah.
Thank you. I'm going to come closer. If I get closer, will it start acting up? Okay.
Yeah.
I get to sit down in a fancy pink chair this time. Okay. So this is the Amplifying Moms of Color Through a White Lens. So first of all, I want to thank you all for being here and being unafraid to speak on this subject. Some people will be silent, so definitely want to appreciate y'all for that. So question 1, making mistakes is a part of our learning journey. If you feel comfortable, could you share examples of what you learned not to do?
You go first.
I wrote these questions, and now I'm like, whew, I really went in.
You was inspired that day.
I was feeling, so this is actually one where I think sometimes we, as white women, we let our shame block us from speaking our experience. And so I had 2 things that I wanted to share. One, like a lot of people, I read White Fragility after the murder of George Floyd. And it was a really great book. I got a lot out of it. But the part that really got to me the most was the portion about white women's tears. And I read it, and I was like, oh my, I have done that. I have had black women or other people kind of try to speak truth to me before, and the first thing I did was start crying. And in this book, it tells me that that is taking away power from black women and making it about myself. And so I recognized that I needed to understand the power that I had, and I also needed to understand the effect that it had was the opposite effect of what I wanted to do. So that was a lot of times did I cry. And so, yeah. The other one is that I think that I also, as I was on my journey to understanding racism, bias, white supremacy culture, I think a lot of times we want black women to do it for us. We want black women to lead our journey, but I really think that it's our role as white women. Like, we are here.
we support each other, and we have to take the lead on that. We don't need to put our change on the backs of Black women.
Do you have anything to add, or are you okay?
Yes.
Okay.
So I think that well, first of all, my staff is here, Janiyah Holland. And so I actually asked Janiyah too. I'm like, and not just today for this question, for this answer, but over time trying to create that space, like, what am I doing? Tell me, how might I be doing things better? But I think I also, at least white women, maybe from my generation too, creating space for women in like the energy sector. I think I've, over time, wanted to be public-facing perfect, right? Like, I've got this together, although on the inside I'm a hot cake mess. I'm not going to show you that because most of you are men, right? And so I think that I have prioritized that public-facing perfection, that persona, over Black women on my staff, just in terms of making sure that they are, I'm creating a safe space for them and elevating them at the same time as my kind of struggling to say, okay, you are now my priority. I'm no longer my priority. These needs that I've thought that I needed to have over time are not as important as the Black women on my staff. They just aren't. And I think there have been situations where I'm like, I have to start this focus group on time. But I know that Janiyah is not here, and they are trying to find their way into this space, and I'm going to go forward anyways without them. And I think, and we process this and I think one of the other questions too is like, how do we make space for those kinds of advancements in our relationships, and how do we show up for Black women in our lives? And I think that creating that trusted space is really important for saying, okay, that was a mistake. And also minimizing anxiety of Black women entering into new spaces where they've never been before, and saying, okay, I'll meet you there, right? Without saying, hey, would you like to meet me there? Would you like to meet beforehand? And then we can go someplace together, go enter these new spaces together. And I think that's been something that I've also had to learn to do, is not minimize the anxiety of Black women when they enter into new spaces, and be as supportive, or even asking questions like, how can I support you as we enter into these spaces together? So those are two honest mistakes. Those are just two.
Well, I'm wondering, this is interesting because it's, thank you for the courage. What triggered you all to look within?
I think, so I was born into a family that has generational wealth because we enslaved Black bodies. And for a long time, I carried that around as my burden and as my shame. And honestly, I was and I don't know, and then I met people, and I realized that is a cop-out. To be like, oh, it's all about me. Once again, like, that's my theme. Like, as a white person, I've made it about myself. And then I realized that I had to be on a journey of unlearning. Unlearning a lot, like unlearning what I learned as somebody who majored in nutrition at UT, and I was supposed to save people with a squash or whatever, and they were homeless, or they didn't have a microwave. And so it was like through experience, by being directly with people, that I had to recognize that I couldn't let my shame overtake me. And then, honestly, I had a mentor that was employed by the United Way named Yashika Smith, and she's the one that helped me carry myself from shame to like activism, and knowing what being like a supporter is. And so while she's no longer at the United Way, I like that gift that she gave me of a safe place to talk about those identities, but not let them define me, was really important for me. And I met Erin about the same time, so finding somebody that looked like me, that also felt like I wasn't a part of the culture of white women. Like, I found myself throughout my life having to be like, I don't identify with these people that I'm surrounded by. Like, I was in a sorority and I had to quit, and I wrote this letter about it to them, and I sent it, you know, and you don't send those letters. And so it was like actually finding people that I could identify with that looked like me. That was also really important.
What about your triggers?
Yeah, that's a tough one too. And I don't want to go back too far in time also, but I think it comes from like our grandfathers and fathers and our, you know, my grandfather passed away in November, and he grew up in the projects in South Boston, right? And he has this great South Boston accent. And so I wanted to capture some of his stories before he passed away, and so I did audio recordings of his stories. And the way that he would talk about South Boston in race, and the way that my grandmother treated people in our family that weren't white. And I feel like there's always that moment too where you have to kind of wrestle with that identity of your family while at the same time listening to this kind of moral disgust that you feel, and you don't know what it is, right? But you're like, something, this isn't right. And I think at a young age, you can recognize that, but then we can talk ourselves out of it because maybe our family identities are really strong and we want to stay connected. But I think that kind of understanding of my own family history, my own family tree, and the people in those families that have participated in racial discrimination. And then my father, you know, retired as a deputy warden of a high security prison in Connecticut. Right? Yeah, and we are like night and day. But just the racism, you know, that I would hear at the dinner table, and my parents divorced, so that I didn't have to hear that all the time. But it was, you feel when something is wrong. And I think finding other people that recognize that alongside you is really important, to be like, no, this is not my identity.
I'm glad we're having this conversation because as you all talking, I'm thinking about the whole attack on DEI.
Oh my gosh.
And how they have turned it around of making people feel bad. But I think we have these conversations. I think this is DEI. Yeah. The stuff that you feel growing up, I think this is the conversation. Back to humanity conversation. Not saying white people are bad and black people are bad or vice versa. You know, I wish people knew how important it is just to look within yourselves. So as you're talking, I am, of course, a descendant of a slave owner. Our plantation is in Strawberry Plains. So I'm black though, right? But my four-great-grandfather was white and slept with a slave. I know his name, but I don't know the slave woman's name. But the son gains Armstrong, biracial, of course. Somehow, I don't know, by some miracle, he acquired the land. That land was passed on to him. So that land is still in our family. So it's like our histories are all mixed up, but the system is telling us that we're not on the same team.
Yeah.
But we really are, because it's all about transformation of your heart. Not the color of your skin. So I just wanted to put that in there. I didn't mean to go off the sidebar, but was very passionate about that. I think we are, let's see, what's the next one? How do you show up as white women to support moms of color in their overall health and well-being? I feel like we touched on stuff, but
I have one thing I
Go
do
ahead.
want to say about that. So, like, one of the first things I told y'all about Ishika a minute ago, but she was like, one of the best things you can do is just say, like, what do you need to be supported to people? And I really embrace that. Like, I constantly just say, what do you need to be supported? But recently, I don't know, I had something that happened to me that made me think, oh no, this isn't even enough. So I was talking to a black coworker of mine and friend, and she had something that happened to her that wasn't good, and it was traumatic. And I asked her, how can I support you? And she said, I don't even know what you mean by that. And I thought, oh man, well, I'm not somebody who's good at asking for help. So, but this, like, we have created a space where people don't even know what to tell you when they say that. But then I thought, like, why am I making a black woman tell me what they need? Why don't I start getting better at telling them what I can do? So I've tried to start doing that more. I've said, you know, I can support you emotionally, right? I can be a place for you to talk, a place to feel safe. I can support you financially. With some of my friends who have been in places where, you know, they've lost their jobs and they have families, I'm just like, hey, can I grab your groceries? Just kind of out of the blue, like, I know you're a single mom and, you know, can I help you, like, financially with some groceries? You know, how can I make people not have to ask a white woman for something that's really hard that might make them feel shame, and I don't want people to get in a shame spiral. So I've tried to be more clear about, like, how can I support you, and then here are the things I actually can do to support you so that they can pick from the things that I have to offer. Because I don't want to say, how can I support you, and then somebody asks me a question, and then I'm like, oh, I'm sorry, I can't do that. You know, so it's like I almost have to take that further. And I think we've forgotten as women how to support each other. I feel alone in that sometimes, but it's because I feel shame in asking, like Erin said, that, like, be perfect kind of mentality. And so I think that's when we all can just do a better job at.
And I think it's just basic, just support of each other regardless of, I still feel like the black, white, brown, it is a separation, but it's okay because I do believe in celebration of cultures and tribes. We all have our way of freedom of expression, but how do we just get to the point and say, I'm gonna support you because I love you as a woman.
Exactly.
And I know it's hard to be a woman. And just get down because we do go through a lot of stuff.
I'll say too, just to piggyback on that too, is I think that there's a lot in terms of, like, management at a management level too, for even a small company like ours, where we're like, how do we support? It's like all of our policies should be supporting the people that are going to need policies the most to make sure that they are caring for their loved ones, right? And that they don't have to worry about being fired because they had to be late for work or take off from work, or because they had to skip work because they had a housing, you know, situation. And so I think even creating a culture in our organization where they feel supported in their basic needs, that they're not going to be fired, right? That they're not going to be let go because something is going on in that an aspect of their lives. And especially for single moms, I think that building in that flexibility and trust into the work, where it's not constant micromanaging, where are you, where have you been, you know, I'm going to scrutinize your timesheet, like all those things, like watching you. I think that goes back to what Dr. Mitchell was saying too about this weathering of women in the workplace, because they're moms, right? They're moms at the workplace, even when they're not, you know, they're not at home, but they're still moms when they're working. And so we just have to be super present and supportive, I think, of that environment and that flexibility and trust that goes into that. And that's not everywhere.
So I wish it was probably childcare in every business that can handle it, or within close proximity of where you work. And that's probably why there's that great resignation. People are looking for freedom too, and they rather, like, I don't want to be a part of this system anymore. I want to be able to raise my child. I want to be able to go get my nails done during the day because I just need a breather because life is stressful. I always say this phrase, life be lifing. And how do we manage that? So thank you for that. Let's see. What is the importance of allowing yourself to be held accountable?
John, you just would come up here. And
Well, yeah, I was going to invite you. You can come on stage if you want to. Come on.
this is a good conversation too, because We were doing focus groups around the 21 counties around Knoxville too, and one of the first things Janai would say when she'd get up there, and she led the focus groups, and would say, "And I'm also here to hold Aaron accountable."
Before you answer that, can you introduce yourself and what you do?
Hi everyone, my name is Janaya Holland. I am a research assistant with 3 Cubed, mostly doing the community engagement on the research part as far as like focus groups, stakeholder interviews and stuff like that. Yeah, that's my... I'm a co-founder for Women with Vision, and I am a licensed esthetician.
Awesome, thank you. Welcome to the stage. So go ahead and start with your accountability. That's a deep sigh.
It is a deep sigh because my motto is I'm going to keep it real and raw. And I think it is important what Erin was saying is having a safe place. She was just saying before she got up for this, when Janaya closed that door, I don't know what she could say when I go in her office. But, you know, one thing as Black women, we have to stop pushing everything to the side when we have a problem with something and being uncomfortable and addressing it. And so that's how I am. Like, if I have a problem with something, I'm going to hit it face on. I'm going to speak on it respectfully, and I'm going to hit it face on. So I'm sorry, I got a little nervous, but I'm not nervous at the same time. So I'm really big on holding them accountable, but also hold me accountable too. If there's something I'm lacking in, if I'm not showing up at my best self, because we all fall short, hold me accountable and let me know what I need to improve in. And I'm really big on that. Like, I want to know what I'm doing wrong so that I can improve. And Erin, so, I mean, it's always a time where we have to just really sit down and, like, talk about what's going on, because community work is so hard, and, like, you're trying to fix stuff and you're trying to move so fast that you don't even realize when you are making a mistake. And sometimes you just need to be enlightened on it. Like, you need somebody to tell you that you're moving slow or that you're not doing something right. To speak on the focus group situation, I think that was my first time I kind of really experienced racism in Knoxville. And they had made it into, usually when we do our focus groups, when we were doing those focus groups in those 19 counties, which this one was different, a different project, but we had said that, like, we're going into these rural counties and I might be uncomfortable. But I didn't even say that. Erin said something. She was like, if you're uncomfortable with going into these rural counties, let me know. But coincidentally, that didn't happen. It was a whole different project when it happened. And they were already there and I didn't know. And I got stopped at the door, but everybody else was able to go in. And not only did I get stopped at the door, I got stopped at the door, went to another door, and still got stopped at the door, knowing that my boss was in that building. And I know that Erin would have addressed it right, but again, she was caught up on work and getting these deliverables done that she forgot to remember that Janaya was outside. But
Forgot to put her first.
And, you know, I left. And Erin called me. She was like, you didn't make it. And I was like, absolutely not. I did not make it. They did not let me in. I was uncomfortable, so I left. So, yeah, I can be a little sassy sometimes, but assertive, whatever you want to call it. But, I mean, you got to when you're a Black woman.
I think as, like, white women, we have to first say, like, it's okay, Janaya, for you to hold me accountable, you know? So I've started in my work, like, hi, I'm Kimberly, it's okay if you hold me accountable, you know? I just would rather that get out there from the beginning. But it doesn't not still hurt. So just because you open yourself up doesn't mean that the things people are going to tell you aren't going to make you feel, once again, like shame, or you might get defensive. And you have to, I even say that, hi, I'm Kimberly, you can hold me accountable. Sometimes that's still going to be hard for me, but I promise I'm going to take some space and listen to what you're saying and acknowledge what you're saying. And then, like, once again, that acknowledgement, action, accountability, that's kind of the 3 words that can get you through anything. But yeah, I think you really have to verbally create that space, because once again, if it's not a safe space, then we're not going to get anywhere. And like, I work at an organization after, once again, George Floyd. They're like, oh, let's hire people with lived experience. Like, let's do it. You know, let's get that numbers. And then I recognize, like, if you don't have the supports in place for people, as Aaron mentioned, like to have that safe and supportive space, now you've created more harm. So I also try to make sure that I can acknowledge and invite people to places that are safe for them and to create that space. But it's also okay to be like, we're not there yet. But that comes back to like, hold me accountable. But I don't think I would have learned those things without people talking to me about maybe spaces I've created that weren't like that, you know, or like the lack of places like Food Policy Council, where I don't always have this opportunity to change the space. But I mean, we can make whatever table we want, wherever we want, outside of some of those really restricted areas.
So how do your peers feel? I feel like you are walking in this path of liberation and transforming mindset. How do your white peers feel about this walk that you are being intentional about? Is it easy to confront those that may still struggle with that mindset? Is that supremacy mindset? That makes sense.
I think there's some people I know that, like, especially when I learned about white supremacy culture in our equity cohort, once again, Yoshika, like, I think it was like around the one around urgency. Like something was said and they're like, well, urgency is a white supremacy culture. And I was like, what? Like, no. And then I started like unpacking like urgency. And so like, we're going to continue to be like, oh, we have to solve this issue now, but we're not even going to take time to build the trust and support. And so then I really went into white supremacy culture deeply. And, you know, you can't just go throw that out to your white women friends, you know, and white women in general, I don't know about. Most black women aren't like this that I've been around, but like there's such a deficit. It's so deficit. It's like, you don't do this. You can't wear this size. You're not doing this with your children. And I hate that. I was literally when we were honoring Famika at Seizure's house, and it was the most beautiful space. And right after that, I go to a birthday for a white friend, and we are talking about like how skinny our bodies are. And I was like, what are you all even talking about right now? There's a whole world of things, and we're talking about our bodies, and they're not beautiful. And so I don't think white women are willing sometimes to even face it, because it's so much easier to just go talk about these trivial things and to ignore it. And I think in Knoxville we have an entire culture of people who ignore people who are facing adversity, whether you know it's a black woman or a poor white woman or a trans woman. You know, I think that it's really hard, but you do find your people and you work together.
Yeah, and I think that's where it comes, where we get to the point that we do more collaboration and have these DEI talks. We need to figure out the code word, because it is illegal to say diversity and equity and inclusion in some spaces, but that's how we bring the collaboration in our community. And even as a county commissioner, I have had my share. And I like to just say, I gotta love you regardless when I want to fight you, but it's real. God's been working on my heart. But go ahead, Erin. I know you want to say.
Yeah, I was going to say, I think that, like in our own organizations, that culture is so important in setting that culture.
Absolutely.
And as a leader in the organization, it's in our onboarding. It's like in our interviews everywhere. It's like, because there's like things you can't say, right? But you can also be like, in this organization, we love and respect everyone. Like, and if that's not for you, this place isn't for you. And just setting that out, and in all of our policies, like I honestly, I think that there isn't that kind of toxic work space. There's even when we're like on deadline and it's stressful, everyone knows that you can't treat each other poorly under no circumstances. Like, right? Like this organization is not going to add stress to your life. Like, we're here to make the world a better place. And if we aren't doing that internally, we're just not doing it right at all. I think the other thing too is for those people that aren't on that path, still showing up in those spaces and saying, like, you know, and I don't want to call out an institution here in Knoxville, you know, but just being like, okay, but we really need to talk about racial disparities now. Like, that's all great. What you're doing is all great. But if we're not talking about the racial disparities in energy and security, if we're not talking about the racial disparities in health equity, then you're not talking about the things that matter. You're not talking, we're not having a real conversation. And that comes with risk. And I think that, just talking about, George Floyd in that post-environment and having those Black Lives Matter statements out there and then saying, I'm an anti-racist, you have to really think about what that meant as an identity. And it's like, and some of that does come down to risk. What am I willing to risk?
Right.
Am I willing to risk something by being an anti-racist? And if I'm not, am I an anti-racist?
Right.
And so that's the hard question, and saying, okay, well, what happens if I risk it here in Knoxville and I lose relationships and partnerships? Well, at the end of the day, that's what happens, right? Because that's what matters. And then building a portfolio and relationships that maybe are more regionally or nationally or internationally based so that you can support the good work you're doing and bring some of that wealth and knowledge into the local space and have it more community driven. And a lot of times when I'm co-designing a project or research or an intervention, I think, how can I do this in the absence of government? And that's what I'm at. That's where I'm at right now. How do I do this in the absence of government? Because it's so challenging, and I know it's going to change the integrity of what we want to do together. And if that's what it means to creating something in the absence of government, then that's how it gets done.
Yeah. And then a little tidbit. I know you want to say something, Janaya.
Maybe.
Okay. Even in my space in government and being the only Black woman, Black person, county commission, I know some of my colleagues are ready, but fear holds them back. Behind the closed doors, they support. But when it's time to get out there, where the real transformation is going to come, it's silence. And how do we encourage them to speak? But you have something.
I think we have to model.
They have to be brave. It's about being brave.
Yeah.
And it's about more voices, more Black, brown, whatever, green, yellow voices out there to stand up and not be afraid. Because I realize once you stand up, the universe is going to take care of you. Because you're moving the universe, God, a higher power, you're moving towards the journey of love. And that's what we're here for.
Yeah.
Love, harmony, unity, balance, however you want to say it. So I just strongly feel within myself, as long as you moving people towards love and finding love, even if you have to war with them, you're going to always win, and you won't lose. And they need that preaching.
And when you say truth, people are going to get mad. Crystal allowed me to make it one of my goals to be more empowered this year and use my voice. And one of the first times I got up in front of county commission, I was like, God, that felt good. And then the minute I got done, somebody marched up to me and told me they were going to talk to my boss and about my agenda. And I was like, oh my gosh.
And you did a great job, by the way.
But all I said is we need to work together. Y'all, I said, I am neutral. I am neutral. And neutral wasn't okay. I said something about something that just neutral wasn't okay. And I thought, I'm a white woman that people are trying to stop me from using my voice. And all the time, like you said, I can't say equity in front of county commission, but I can define it. I can't. And so I've learned that, you have to be smart with your voice and don't just go fight them because don't let them win because you can't say a word. You're smarter than that. We can work around that. Gray is great. But yeah, people are going to get upset, and you have to have an Aaron to be able to call. You have to have a Crystal to be there to support you. You have to have a Daisha who tells you thank you, because breaking the system is going to make people really mad.
And you got to be very savvy. So I told myself in 2024, I'm not going to use racism anymore. I'm not going to use the R word. I'm reading the cast.
Yeah.
So I that's a form of casting. Okay, let's talk about this. So that's going to be my new strategy. Because I feel like we're born to infiltrate the system. You have to have a warrior mindset to infiltrate systems. to disrupt them.
Yes.
We can't say, in some cases, the state legislature is probably the worst. I've been told I can say it to city council, but I can't say equity or justice to county commission. And at the state level, even words like social determinants of health are going to get people ignoring you from the beginning. We live in a place where today I have told everyone I feel so safe. I've heard people be able to say things today that I don't know that we're able to.
But this is a safe space.
But this is a safe
The real
space.
space,
But
yeah.
now you know, and now you know that you gotta just define it.
Yeah,
You
and
literally
UT
just
can't
define
use it.
Yeah.
UT, the university system, so the former, well, he's still the vice chancellor. It was diversity, equity, and inclusion. Now they changed it to engagement and access. So I think state departments cannot use the word. So that's where we are. And I had to speak at the WCA Diversity Day, and I say, do the work. Don't fight.
Don't fight.
It's not worth fighting for that word. It's worth fighting for the work and the transformation. So don't get angry and caught up in that, which is easy to do. Yeah, it's just do the work.
Look at it as a challenge.
Yeah, just do the work, and it makes it fun when you get the kind of okay, I'm gonna change the word on you because I know you don't know that word.
Oh, I know.
And you ain't gonna know what it means. But I okay, I changed the word. I won't say the R word anymore. Okay, I got you. But yeah,
I heard you.
do y'all have any final thoughts or anything?
Well, what I was going to say is I think that the workspace that I've been with 3Q a year and a half, and I think that the workspace Erin has created is very rare. Being that we can hold each other accountable, but also understanding that I am a single mother and I do have responsibilities throughout the week. I do have a son that's in therapy on Wednesdays, and my team knows that I'm leaving early on Wednesdays. If you need me, I'll be available in the afternoon. But also, speaking on the racial equity, and kind of the same question you asked is the same question I've asked this week, multiple rooms and meetings we've been in, is how do we create a space in Knoxville to talk about race? And it doesn't even a race thing, it's just the social determinants of health. This is in Black and brown communities, this is in Hispanic communities, this is in South Knoxville that's predominantly white, Black, Hispanic, whatever you want to call it. So we have to create that space. The project that we just did with this people.
You can say it.
With UT Medical Center, you know.
No,
I'm sorry.
Sorry.
She
I
told
didn't
me.
mean to.
You know, I did focus groups for 9 months. That was a lot of sacrifice. That was a lot of work to travel those 19 counties and to get a message before walking in a meeting about the state of Black Knoxville to tell me that we can't include racial equity in our profile on the project we worked in 9 months when they all blow us down to money is crazy to me. But it's also more crazy is I feel like I've always had the ability to advocate for myself. And that's hard, it's uncomfortable, and it stings and it hurts because sometimes it's why do we even have to do this? Why are we still in these systematic places? But when your hands are tied and you can't advocate for yourself and things are just stuck on how they are, it's whew, did I just do all that work for nothing? But it was funny because we were in the hallway talking about, I don't even know what we were talking about, and the idea popped up in my head. I was like, well, if they don't want to let us include it, let's create our own report. So you definitely have to be a mastermind and think of different ways to go around the system. And yeah,
Reframe.
so it's a way to beat the system.
It is, and we can do it together.
Yeah.
Well, I appreciate you all. This has been fun.
Thank you.
I think we have to get ready for the yoga session next.
Oh, yoga.
Does anybody have any questions or comments before I close this out? Everybody's at peace. Yay. Thank you. the battlefield, like in the front. Like I see all these people lined up for it. Yeah, so
Yeah, I think it takes time to.
yeah.
It takes so much time, and I think for people fall into phase two. Like I start to see it, you know, in more and more
It's more, yeah.
these kind of connections, even this data Black Maternal Health happen. I just feel like it can be used as a time to maybe even provide models of how do you make changes? How do we even think about data ownership and where we've already done that, and we already have a model for that, and so we have a framework for this, and we have a model for this.
Yeah.
And so it's like almost like we've been pre-packaging
Everything.
all these ways and approaches to get something done. So then there's like a menu, you know, of like, oh, well, have we thought about doing this way? Oh, well, this group over here has already done this.
That's what it like. Everybody just been building the foundation, and then when it's time to launch, it's like we're not gonna be fumbling. It's here.
Right.
Been there, done that. We did it in the dark, and it's come to light. Yes, I love it. I appreciate y'all. What part are we? I was like, what part are we at? I don't know. Well, oh yeah, it's amazing. Oh yeah. Have you watched the movie? Yeah, it came out I guess earlier this year, but that's what inspired me to recast. It was a It's a movie. It's not called Cast. I forgot what it's called. But yeah. And when I start reading, I say, "Okay, God, I know the strategy. I'm not gonna use the R word because every time I use it, they get defensive." Right? So I'm like, "Okay, I got it. I get it." So, I need to. Okay, my next book. Uh huh. What's your sign? Oh wow. Okay, I'm going to. Yeah, I'm going. Okay, I got it. I love it. Thank you for that. And I love your hair, by the way. Also, who's ready for yoga? I really need to give away some stuff, and it's been really hard for me to do that. I got like we got to pull tickets and stuff. So, well, it came. It's already in your little badge. Your badge in the back. It's the white. Yeah, yeah, yeah. So you go. Probably do it at the community forum. Yeah. You supposed to start at 3. Okay. Okay. So I am Aya, and what's the day wellness? Okay. wellness, yes. Let me know when you're ready. Huh? So if you want to do yoga, there's a mat. Do we use these mats over here? Grab your mat. Don't be shy if you're not flexible. I lack flexibility. Yes. But I know how important it is. I did my thesis on stretching. Yes. Yeah, I'm not compliant with myself. Yeah. Yes. Do y'all want to do yoga? Everybody's leaving us? Well, let's get some mats out. So while y'all do that, this is Aya, the owner and operator of Day Wellness. She has been a practitioner of wellness concepts for over 20 years. When her late husband and her dreamt of us starting a business for community to have a safe space to gain knowledge and access to holistic forms of self-healing for BIPOC individuals and families. The Wellness Center features yoga, pole fitness, twerk shops. Yeah, we should have did a twerk shop here, but she might can fit that in. I don't know. I don't. What is duty wine? Duty wine? Dunty wine? Oh, she gonna get us right. Sound best. Okay. I'm handing the floor to you now.
You can be audible. Allow that negative energy to go out. Do 2 more cleansing breaths for me at your own pace. Remember, yoga is at your pace, not at mine. When we do start positions, please listen to your body. Do not do everything I do. I'm extremely flexible. I do not want you to hurt yourself, okay? We're not going to go crazy either. Where's the babies? We don't have any babies in here? Other than Miss Cat. So, when you notice that breath going in, did you notice something different as you were inhaling and exhaling? If you didn't, I'll bring it out to you. The air was cooler going in. Remember doing that, and here's another form of breathing before we go into our actual postures. If you have anxiety, I have severe anxiety, nasal breathing is something that will help lower your blood pressure and help you to resume your natural breath pattern so you're not going into a panic attack. I panic a lot, so I know this. All you are doing is holding down one nostril and inhaling in the other. Very deeply. As you exhale, hold down the other nostril and blow out that same nostril, not your mouth. Do that a few times. Let's do 4 times. And allow yourself to notice how you might feel a little dizzy as your blood pressure is dropping. Allow yourself to feel that cool air going in as you inhale. And so this is almost like mimicking blowing in a bag, but you're not blowing in a bag and you don't have a bag present. Always use your nasal breathing, so that's just a tidbit. I'm going to put this down because I'm loud enough. elbows in, and inhale. Exhale as you're going down, and inhale into an upward dog. So if you can't go all the way into an upward dog, you can go into a cobra, which has a bend, but your elbows are still in, not out. Or you can go into a sphinx position. Elbows are all the way down. So whatever works for you. We are about to go into a downward dog. When you do, I want you to tuck your feet and your toes and push your hips back. Drop your hands back and push your hips back.
Thank you. How does everyone feel? Do you feel like you're going to conquer the world now? A little bit. Workout is tomorrow. So, so now we're going to transition to Bianca, right? Okay. Set up all the chairs. Uh, about 20 chairs. Okay. 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 Cool. Okay. Cool. Yeah, right there. Yeah. Okay. Do you want to do your? Okay. Okay. Yay. You can keep up with yourself. I say you can keep up with yourself. Since she was gonna have me move your PowerPoint, so. But you're gonna click her. Or you just let me know if I need to do it. It's whatever's easier for you. Okay. I'll be here. Doubt. I don't know. I'll tell her. Okay, yeah, that's fine. Because I'm going to introduce her. Okay. What you Oh. I guess I can go ahead and introduce you, and then we wait on our our special guest, I guess. The lady that you're. Okay, cool. Okay, y'all ready for this next? Let me get myself in order, y'all. Okay, welcome to the demos session. Your beautiful scars. Scar tissue massage with Bianca Julian. Be intuitive massage. Yay, let's clap for her. Yeah. Bianca, born in Cambridge but raised in Boston, Massachusetts, Bianca Julian is making a name for herself by being a wholesome family massage therapist. Bianca is a licensed massage therapist in both Massachusetts and Rhode Island. She is certified in perinatal, prenatal, postpartum massage, and infant massage instructor of Infant Massage USA. Bianca is also a mother to 4 beautiful children, a homeschooler of 11 years, an author of 4 books, and a licensed financial professional. She is also a first-degree black belt in Krav Maga. I don't know. My God, that sounds scary, and I don't want to face you in the match. With her company, Be Intuitive Massage, Bianca wants to bring holistic massage to the whole family as a step towards a more healthier, harmonious you. Bianca believes that the power of touch can not only help heal the body, but the mind and soul. So welcome Bianca to the stage, or to the front.
Thank you, thank you. Did she get the clicker thing? That's not the right. All right. So, like they said, my name is Bianca. I've been doing massage for quite a while, but professionally, I started after the pandemic. So I've only been doing it for 2 years professionally. Right after I got right after I graduated, I studied under Carol Osborne, and she's known as the godmother of prenatal massage. I was part of her last group, so she's not teaching anymore. She's doing more coaching, but I was very fortunate to learn under her. Postpartum, like somebody had mentioned earlier today, is like the gray area. Like nobody really knows what to do. Nobody knows the resources, etc. So when I mentioned that you can massage your C-section scar, people are like, really? You can do that? I didn't know that. Oh, I needed you like 5 years ago. And I'm like, you could still do it now. You still got it, right? So I just put together like a small presentation just to give you a little bit of a background before we do the demo. All right, so what is scar tissue? Scar tissue is defined as fibrous tissue that forms when normal tissue is destroyed by disease, injury, or surgery. Scar tissue can be anywhere on your body. So
For C-sections, obviously it's on the top of the skin. If you know any athletes, like I work with track and field athletes at Brown University, so there's a couple of them that's torn their hamstring or their meniscus or something, so scar tissue will form there. If you know anyone who has broken a bone, ankle bone, collarbone, the humerus, the elbow, whatever, scar tissue will form. So scar tissue is just your body's way, natural way of just bringing back together the brokenness that happened. So there are there are some effects of scar tissue, even though it's bringing things back together. People do lose mobility. So if you've ever cut yourself and it came back together and you're like, this feels weird, you feel that hardness, that's the scar tissue. You can have restricted range of motion, loss of strength, or joint contractures. So that's why it's very beneficial to massage your scar. You have better tolerance of force and stress. So moms who have C-sections, after your baby is born, you're obviously moving, doing your thing about the day, but when you have that scar, it kind of limits you. So by massaging it, it allows you to move a lot more fluidly like you normally would. More pliability, less pain. When I was doing my studies, one of the therapists that were teaching, she told a story. She said that this woman came to her to get a massage, and she asked her, oh, did you have any children? And the woman said, yes, I had a C-section. And she was like, oh, how long ago was that? Oh, it was about 20 years. And she's like, do you mind if I massage it for you? And she's like, okay, fine. So she did a normal massage session. She also massaged her scar. And after the woman got dressed and they had a debrief afterwards, the woman was crying in her arms because she's always had pain there at the C-section. She thought she had to live with that forever. So you can experience less pain if you feel pain there right now. And it reduces the thickness, reestablishes normal range of motion and mobility. So there are some precautions and contradictions. You should always talk to your healthcare provider before you do anything in regards to your scar. You want to make sure it's fully healed. Sometimes they say it takes 6 weeks or whatever, but sometimes it can take longer. So you always want to make sure you do that. Massaging an unhealed scar may open it up, and it can lead to getting bacteria in it, infection in your body, and just a whole list of things that you don't want to deal with. So I had a little timeline on here. So before 6 weeks, you have to avoid that area. Obviously, you wanted to let it heal the way it's supposed to. But you can massage like the upper abdomen, push down on your uterus to kind of help that contract a little bit. Between 6 to 12 weeks, you may be able to apply light pressure. Everyone is different. Everyone's tolerance of pressure, pain is different. So whatever you can tolerate, that's what you can do. And then after 12 weeks, and obviously after clearance, you can massage above, below, and on the scar. Some self-care tips. So I suggest you massage your scar at least twice a day. It's something that you can just throw into your routine after you get out the shower, I feel is the best. So once you get out and you're moisturizing your body, it's easy to just kind of do it then. You never massage without lubrication because you can, like I said, still open it up or cause some kind of friction, which you do not want. You want to keep the scar and your skin soft and flexible as possible. These are a list of oils that I recommend. Obviously, you can cater it to you or your client. Some people are allergic to like coconut oil and stuff like that, so you can use something that's better for them. I always recommend vitamin E though, because for some reason, some people like say with stretch marks, people don't like the way they look and they want to lighten it up. So vitamin E and anything can help with that. Your massage should never be painful, so you should never be doing something like this or crying or whatnot. If it's too much pressure, if it's too painful to touch, just don't touch it. And it could be a good bonding moment for you and your body. Oftentimes with moms, we become disconnected from our body after we've gone through birth. So it's just a way to reconnect, or you can do it with your partner or have your partner massage it for you, so it could be a good bonding moment between that. Other things you can use. So I always recommend using your hands. They're like free. You always have them. You don't have to go to your drawer. You don't have to go back home to go get them. Your hands are always available if you want to massage yourself. But however, like I said, some people have other kinds of tolerance of pressure. So there are other things you can use, like a foam roller. You can use a massage. You can use a massage stick, so it has like handles. You can kind of do that. You can use like a little massage ball, and you can use it to massage. You can use the gua sha that they use with your face, and you can do that. Or you can use a massage gun. That one I kind of don't really recommend, but some people do it. So right here we have like some of the basic techniques, but I'm gonna demo on someone, like my own curated routine. Like I said, I was taught some things, but then I also got some other tips from like physical therapists. So I just kind of put it all together. All right, so you can come up here. All right, what's your name again? Maya. All right, so we have Maya here. So she's going to be my my demo person. So I'm going to have you lay on your back, which face up. All right, I put this down. I'm going to put this down.
did. Yeah. It does, like, yeah, if you truly believe in it, I do hospice care too. We talked about that. They was doing Reiki. We had a nurse that did Reiki on some of the patients, hospice. I did a little bit. For some reason, somehow God led me to a place yesterday because the lady was transitioning and they didn't tell me. So I'm going to go like thinking I'm doing therapy, and I'm walking in like, I think she's dying. but I always, even in that space, I had to honor that space because I see her daughter was just kind of just getting old. So I just laid my hands on her and I said, all will be well, because we knew her transition was going to be rough, just because her life was rough for her, and her family situation was rough. So I definitely believe in the healing touch of, just kind of letting her say, you can go on to the other side. Yeah. It is. It is. You feel better when you get touched. Yeah. Yeah. I see that a lot. Uh-huh. Yeah. Yeah. Okay, yeah. And we live in a world that's not used to it. Yeah, and we not getting it because we become so off off limits. Hmm. Yes. So how does everyone feel right now? Feel good? What time is it? If somebody want to go outside and tell Famika and Alexis to come on in. Oh yes. Does anybody want to come hang out in my living room over here? So I do. So I have been non-compliant, which I'm not surprised. I have not given out any gifts. And I need a strategy on how to give out gifts because, yes, I don't want to pull these numbers and we're going to be going through numbers all day and the people are gone. Does anybody have a creative way for me to give away gifts? Do I write a number down and whoever gets the closest number? Okay, do we want to guess? Well, let's do this. Did anybody have a birthday this month? Any April birthdays in here? Okay. Any January birthdays? We not counting yours. February birthdays? March? May? You not getting none neither. What's after May? June? All y'all born in the same month? I mean, July? Okay, 2 Julys. What's today? Who is closest to July 13th? So I think the 10th. You win a prize. Yay, I can give out a prize. Famika's going to have to help me. Because I want to give honor, or I don't know. Is it in here? Okay. Oh, well, you don't really need that.
So this is a self-care package from our friends at Readiness Counseling, Sarah McNamara. She is a licensed clinical social worker. therapist and clinician. And so this is just a little something in here. They have some cards, a notebook, a cute bracelet. It looks like a hoodie and a journal. So who's the winner? You're welcome. Let's see. Are we still drawing? Oh, we'll be here forever? Okay.
Is there, okay. Is there? Okay. I'm trying to figure out what to give away next. Okay. So I left off. What month are you again? July. Okay. Okay. August birthday. Yay! Huh?
Are you local? Okay, you may want this. Okay, our girl hooked you up with Indulgence Nails. Okay, we have $100, Manny and Petty. Okay, from Indulgence Nails. She is a black nail tech in our office space. Alexis and I work in the same office suite as her, and she does any type of mani and petty known to man. Okay, praise the Lord. Okay, see, ask and you shall receive. She also specializes in medical grade mani and petties as well. So if you know anybody that needs that type of service, she is wonderful. And it's a private nail tech, so you don't have to experience all the rustle and bustle in a nail shop, okay? Do me a favor. I'll need your name. That way we know who we're sending over to her for the prizes. Can I get a pen and...
Okay. What you looking for? I'll do one more. We're doing birthdays. Sorry. We just figured if we kept drawing and those people down here, yeah, so we. Okay. After so the next month is
Who has a birthday in September?
okay, so there's two September birthdays. So how we handle that, I want you to pick a number between 1 and 30. You in your head. Okay. So whose birthday is closer to number
29.
September 20? You're September 3rd? Okay. Okay. So she's the closest. Okay. What is this? I don't know. I don't know. Do you? Thank you. Y'all ready to get started? Okay. Well, that's all the giveaways for now. So we are entering into the community forum with the founders. Give it up for Alexis and Famika. Okay.
wants to do this. She on the clock. Tell her now. It's her time to shine. So we're just gonna open it up just for like questions and dialogue as we wrap up for today. We just want to give you all time to just decompress. If there's any takeaways, what's your rating of today, how today went despite the technical difficulties, questions for us, questions about tomorrow, what you're excited about, just your overall experience. So we just wanted to share space with you all and allow you all to just have dialogue with us before tomorrow's excitement again tomorrow. So
Don't be shy.
Right.
Anybody?
No
Nobody?
questions? Nobody?
Silent? All right.
Okay, Tammy.
I just wanted to say that I've really enjoyed today. I feel like that not only have I learned a lot, but I have felt camaraderie within the community and feel like that I do have more resources that I can use and connect to my own community in Cobb County, and also things that I've learned myself that I can take back to my community that otherwise there's no way they would ever be able to come here and learn this type of thing, you know. So I really appreciate that, and this has been very beneficial to me.
Thank you.
Thank you for being here and being a great and awesome volunteer.
Yes.
Yes, thank you.
Anyone else? Any questions?
It's probably more of a comment, but I would agree. I've learned a lot today, and I think as like a white healthcare worker, it was a safe space to learn how to create a safe space for people. I do my best, but you know, sometimes there's things that I can't account for that I'm not aware of. And I can also say, as a woman who does have a tendency to go towards communities that are underserved, it's nice to be validated and to, I think someone said earlier that when you say hard things and you say the truth, you're gonna get yelled at. And so knowing that you're not alone in that is nice. Just have a
Thank you for being here.
Yeah, thank you. Anyone else? Anybody got questions about the policy?
Right, yeah.
No way.
You've been with us. You've been with us, nephew.
The whole
Thank
way.
you. Thank you for walking alongside of us.
Yes.
Okay. Nothing? Okay. Well, oh, Dr. Miller. Okay.
Just where.
Hello.
Where is the bill, and are you still having to go? Do you go every Wednesday?
So we really wanted to update community here at the conference this weekend. We have passed the Senate floor for those who have been staying up to date on the bill. And last week, we also got passed through the House GOP. So we want to share the good news that it has been passed through the House. We are waiting for the release date for the calendar for it to be signed on the House floor. And so, yes, it's got passed through both sides.
So, do we have any other questions regarding the bill? Are we going to go into the bill if there's not any other questions? 'Cause
I think that would be great.
It's very important for community to understand the complexities of the bill and that it's for everybody. Any other questions before we run? Okay. Leah, can you give the mic? Come on, baby girl, get in your job.
Are the same vendors that were here today going to be here tomorrow? And she needs to come down here at least once or twice a month.
Amen. Won't he do it?
Yes.
I've been telling her, we're working on it.
So that we can book some massages. I do like to travel now. We will go on a trip, but I really appreciate you because not a lot of therapy like kind of go towards that area. And it's very nice to have somebody who specializes in us mamas postpartum. We need love too, especially because we neglect ourselves a lot too. So, yeah.
It's our first time in Tennessee, by the way. We finally got her here in the Tennessee state line.
Yes, yes, yes. Okay, so I was trying to find, I guess I will find that tomorrow, but I was looking for
We can go into it
the
tomorrow.
video.
Also, for those who have seen the art gallery side, which is on this, come out on the left side, there's research posters of certain articles, and then also part of the bill is posted on there as well for the policy piece. So it shows you the policy that was formed from the beginning until the House bill of where it's at now. And so if you want to kind of just reference that and read through the aims and what it's for and what's the ask for, that would be beneficial too.
Caroline, can we turn this projector on? Because I have it pulled up right now. We're just gonna cook and roll through it because I need everybody to understand what's happening. Okay, so this originally started out as in the Senate as SB 1832. It is sponsored by Senator London Lamar out of Memphis, Tennessee. Now it is House Bill 2226 by Representative Love out of Davidson County, Nashville, Tennessee. And so, let me get this, trying to get this pulled up. Oh, y'all can see it. So it says, whereas according to a 2020 Tennessee Department of Health report, maternal mortality rates in Tennessee have doubled from 15.5 deaths per 100,000 live deaths in 2013 to 29.4 deaths per 100,000 live births in 2020. And whereas black women in Tennessee are 3 to 4 times more likely to die from pregnancy-related complications compared to white women, and whereas in 2021 the Tennessee Maternal Mortality Review Committee found that over 60% of maternal deaths in Tennessee are preventable, and whereas Tennessee ranks 43rd out of 50 in the nation for its level of maternal health care support. And whereas it's proper that the General Assembly provide funding to Tennessee community orgs and undertake other legislative initiatives to improve maternal outcomes for women in this state, now therefore be enacted by the General Assembly of the state of Tennessee. This act is known and may be cited as a Tennessee Maternal Health Equity Advisory Committee Act. Tennessee Code Annotated Title 68, Chapter 1 is amended by adding. And so we came up to Capitol Hill with something already drafted, and as soon as we walked through the doors, typically lobbyists don't have policy already created. They typically go and lobby senators and representatives and say, this is the issue that I'm having. Can we co-create something together? Or can you just do something and then we'll just lobby everybody else in the Hill, right? And so this was a very unique situation because when we got up there, we already had something in hand. And so the first day that we got into Senator Lamar's office, she was like, this is great. And she was like, can I make some edits? She made 2 edits. And she was like, okay, when can y'all send this to me? We came with our laptops. We said, you'll have it in 10 minutes. And so we made the edits. And she asked, well, do you want me to push this? And we're like, push it when? And she's like, today, I'll send it to legal by close of business. And so it went to legal that same day, and it's been rolling every other week since. And so this has been just speaking with a lot of senators and representatives that we have, tried to develop a rapport with. They're talking now, and they're saying this is like super fast for a policy to be pushed. This year is like one of the shortest sessions in legislative history in Tennessee. It's closing this month. And typically it runs throughout, like the school year, right? And so this is a very unique situation. So just imagine going up there every week, being birth workers and working contract jobs and working for a community and doing this every single week. Sometimes it was like a 3-day turnaround and we had to go right back. And so that can really make or break a policy because sometimes, these senators and representatives need help. Sometimes they're not well versed in what your what you do, what your expertise is. They may be passionate about it, but they may not have the depths of knowledge to really articulate that to their constituents and to the people that they sit with, you know, in Capitol Hill and on these boards and committees. So it was very important for us to develop something that was centered around community, but also community-based organizations, because as we know historically, we know who all gets the funding, right? If you don't have a 501c3, don't really know how to run it properly, that can be a barrier. If you're a solopreneur birth worker, typically, that is not a 501c3, or you are, you may not have the capacity to go for federal grants, right? And so that's really time consuming. You got to jump through the hoops or have the team and manpower to do so, or come under a large umbrella of a larger organization and fight for the scraps and pennies. So we said, well, we're not doing that no more. So let's come to the table. Let's see what our birth workers need, but also what our families need, and how are we going to close this gap? Because just having medical professionals from the Western, you know, medicine industrial complex on all these boards and these review committees, obviously the gap is not closing and it's not working. So where are your community voices? Where are your birth workers? I'm not sure if y'all know, but there is a doula advisory piece of legislation, that law, and they've been hashing that out over the past 2.5 years. The Capitol has just digested what a doula is and actually understand it now, somewhat, not fully, right?
They're doing a pilot program right now.
Right, and they're doing a pilot
Task
program
force.
right now. So what happened was we went in, we saw it from a long shot, right? And we said this is not going to work because the stipulations surrounding on that committee, you have to have experience in accepting Medicaid, which we know most community-based doulas don't do that. That reimbursement model is not equitable at all, right? And you have to practice for X amount of years. You got to turn in your certification, all these hoops, right? And so most of these doulas that are on these boards are Caucasian doulas, right? But they're also doulas that are not operating in the silos of marginalized communities as well. So when we talk about filling in the gaps, that was something that we saw from a mile away. And so when we went to Senator's office, we got up there, and it so happened that some of them from the doula advisory committee were in her office, and we were ear hustling, okay? But we heard, she was asking, because we had her meeting. Right, we had the meeting with her briefly before they came in. So she was like, "Well, just wait. We'll wrap up our meeting." And she was like, well, "What's going on?" Too. Right? It was TenCare. TenCare was in her office, and so she was like, "Well, what's going on? How's the advisory committee?" And they said, "It's not going too well. I really wish we had grassroots organization on the review committee." We're right here. We told y'all this 2 years ago, and we're at year 3, and you're just now, so it's stuff like that to where it's very important that we have to get together and co-create and form camaraderie, because there's absolutely no way, you can coexist, whether you're in the medical institution, hospital setting, or out in communities, but bottom line, women are dying postpartum. Those are most of the fatalities when they leave your office out of the hospital. And so if you're ignorant to the fact and not educating yourself on what community-based organizations exist within your community where you can refer out to help a mom not fall through those cracks, what are you doing, right? And so when we went up to, the department, we were telling them, okay, we have the data. There was a senator that was like, we don't need no more data. We're tired of the data. I'm in a rural community, and I'm tired of hearing y'all still collecting data. She said, what are you going to do? And so, really setting a tone and saying, hey, we've done our research. We are of the community. We've experienced this as well. No, the focal point is not Black women, but we are here to advocate for Black women priority first, right? But this also includes rural women as well in this bill, because you have maternity health care deserts, all right? And there's not a lot of community-based organizations operating in a rural community too, right? You're low-key marginalized too. right? So it's just like looping in the farmers. So I had to leverage myself as an urban farmer, right? So sometimes you got to relate to these people a little bit. And so, you know, I went up to a lot of those rural white men that had generational farms, and I said, hey, how far is your wife from the hospital? 45-minute drive. I remember that drive. I said, okay. And so like that, and so I feel like that's what really helped with some of the votes when it started moving through Capitol Hill, because other than that, if we would have made the focal point being in the Bible Belt of Tennessee Black, it wouldn't even made it to the desk at all.
Yeah, I think too, being there, showing up, and boot gaying our way with meetings with senators, because we was not on their calendars. We need 5 minutes.
No calendar.
Very brief.
No appointment.
So I think that plays a role too of just making sure that you show up. We was very strategic, making sure that we had one-pagers that understood the importance of this specific bill. And also that broke down what the Tennessee Department of Health for the state has offered. And right now they're only giving recommendations, and we've been past recommendations.
And the recommendations are to their counterparts in the hospitals, and the recommendations are to some of the family members, but it's like call the hospital. Nothing else.
Yeah.
No, it's nothing actionary.
So, yeah, we definitely continue to push. We would love to have a movement and support as a unity, not just for Knoxville, but surrounding counties. We want everyone to be behind, especially for those who are in the healthcare professionals who are community-based organizations in the grassroots. This bill is for you. This bill is for all of the women in the rural counties and for all as well, just in the whole state. So what we are pushing is way bigger than us. It's for everyone in Tennessee. So I really cannot stress enough too, if you have not read the bill, if you have not been up to date, please stay on top of it. It tells you when it gets passed. It tells you when it gets signed, what dates, when the hearing is. It even have the recordings of the hearings.
And you can live stream it.
So just stay up to date. We would love to continue to co-create new policy, new bills, because we still have a long way to go. I know multiple bills I still have in my back of my mind I need to push for the Tennessee statewide. So, yeah. Anything else you want to add?
And it was a lot just pushing one bill. So when y'all asking to build 5 and 6 things and make like 5 bills, I'm like, it was hell with this one. Like, we need y'all help, right? So I'm going to go into this just a little bit more so y'all can understand, like, just kind of just offer some frameworks. And so it just talks about, like, the lack of access when we're talking about, like, the social determinants of health. So Alexis and I work, like, it's really holistic. So, yes, even though we're in birth work and nutrition, we also provide clients with transportation services in referrals, like housing referrals, mental health referrals. But down here to number 3, it says community-based organizations play a critical role in improving maternal health outcomes through patient navigation, childbirth education, doula support, and addressing the social determinants of health. We also talk about increasing the workforce as well, but in 681-2502, it goes into talking about how this committee is formed and what we originally wanted it to look like prior to the amendments that were made, right? And so we said that we would like for it to be composed of 11 members. We did not want these members to be appointed by the governor, okay? So that has changed in the amendment as well. We said that members are appointed based on their demonstrated expertise, experience, commitment to addressing maternal health disparities, with an emphasis on appointing members with experience working with grassroots or community organizations, right? We said appointees are representative of each grand division within a state with representation of both urban and rural areas. And efforts are made to ensure that the unique needs and perspectives of minority women are represented by the membership. So, serving 2 years, each term will begin July 1, ending on June 30th, 2 years later. Each member may serve multiple and consecutive terms. And then it talks about like vacancies. Now, we did say that, well, we didn't say anything about a quorum. So it's just when it gets kicked illegal, they fluff it up, and then they kick it back, and then they start making amendments from there, right? And so they talked about having a quorum, but now one of the amendments are we do not have to have a quorum to continue to meet with the committee, right? And so let's see, members will not be receiving compensation. We had to build it out like this because whenever you have like a fiscal note on something, they tend to keep it, like it dies real quickly in the Senate. And so we didn't put a fiscal note on it. Now there is a fiscal note on it. I don't think that the number has came yet because it hasn't went to finance, but Senator did put them on notice that it's going to be fairly low. So the goal is, no, we're not asking for more money. We're just asking for the federal dollars to matriculate equitably to these community grassroots maternal health organizations, right? So not giving it to the huge 501c3s, you know, that typically get it and they're not really operating in integrity with it, or they not really having an impact, right? Like community birth work is trench work, right? And we operate off pennies, and so we were like, this is what has to happen. So you also qualify too if you're not a 501c3. So we asked for a innovative payment model as well. And so if you've ever heard of fiscal sponsorship, if you don't want to be a 501c3 on paper, but you operate as one and you would like to go for grant funding or any funding where, it's only for 501c3s, you can partner with a 501c3 that knows how to handle their money better. And they will basically intercept the funding for you, and you'll just use it as you please based off of the grant stipulations. And so because we found out that a lot of community birth workers, even that weren't 501c3s, were getting like just barred from federal funding. You know, all this nice maternal health funding, right, is up in the air right now. It's coming down fairly quickly. There'll probably be something tomorrow on it, but it was knocking out a lot of great community-based organizations that had been doing this impactful work. And so we said, we need innovative payment models. I'm not looking to continue to talk about Medicaid. Yes, that's important, but we need other alternatives as well. Like, as birth workers, we deserve to be paid. This is very energetic work. We can operate on a sliding scale as well, but the government has models that they can, just look at and take into account to be sure that everybody gets a piece of the pie and mothers and families have access to great care, right? So it just says, like, the purpose of the Maternal Health Equity Advisory Committee is to systematically review maternal health data, identify disparities in maternal health delivery, and formulate recommendations to the department. So yes, this will be under the Department of Tennessee, under the Department of Health for Tennessee, but it's basically just giving community-based organizations and community birth workers a seat at the table with the people that typically makes these decisions and recommendations. So we're not trying to reinvent the wheel, we're just trying to expand the wheelhouse, is what I say, and just not do their work for them, but just let them know that we are your missing links. And this is really the only way that we're going to be able to close this gap here.
It's more work to be done. It's not enough.
Definitely. No, not enough. Yeah. Not enough at all. Let's see. And so this just talks about the funding model. It says that the funding should be directed to reduce maternal mortality and morbidity rates. We should also have additional funding for community-based organizations outside of the medical settings. And we specifically did that because, as we know that medical institutions like UT, like Tenova, especially the research institutes, get a lot of money for these things, right? And so sometimes they say that they want to work with community-based organizations, but it's only certain organizations that they will work with over and over, right? And so it's not, those statistics just kind of remain the same, and it's not as impactful as it could be.
For example, UT Medical Center has pushed an initiative for doula collaboration. I will give that for example of what she just talked about. So for it to be considered a doula collaborative, you have to let them know when you are certified, your continued education, when you have to recertify. It kind of gives off like a database collecting, and you get a name and a plastic card saying, oh, you're a doula collaborative and you have access to all these additional things that I already have access to. I know how to get ice, I know how to get to this room and get this, so you're not giving me anything additional to my client. And so that is something that is trickling down, that's already took place and started April 1st. And so now with that example, they are trying to create a whole doula committee, with only picking 4 doulas that has to have at least 20 births at UT Medical specifically.
Mind you, they did not read the bill. These are birth workers that came up with this, okay? Number one, this is not no tea, this is truth, okay? They listen, right, Barbara? So they knew about the bill, right? Why are we coming up with the doula committee when there's a doula committee at the state level? We have doula organizations here. We have the health department. We have the birth equity task force here with the health department, and then we're trying to advocate for doulas and all birth workers to include doulas, not just doulas, right? So it's like those things that are festering here in the birth
It's
network,
happening.
right? Like it's happening
It's
in real time. Yeah, in real time, and so. You know what's going to happen, Barbara.
So I just want to throw that in there because that's actually happening in real time right now. And so I will be showing up like I always do in these spaces and at these hospitals right after this conference. Because that's,
And I'll be right behind her.
Yeah.
Without my certification.
Specific for here, so they did a doula open house specifically for Knoxville area, and they made it open and told you the time to show up, and if you did not make the time, you were not considered a doula collaborative. And then we suggested that, hey, you need to have more than one, you know, because you can't just make this a one-time open house, because you're going to leave out a lot of new doulas, right, or doulas that's in surrounding counties that still come and support clients in your facility. And so they end up doing like 2 or 3 more meetings, and that's it. So now it's rolling out and it's starting, and we need to really look at what's the true essence of this collaboration. Because if you understand the importance of doulas and you know how valuable they are when they come and support clients in your hospital setting, then you really need to make sure you're making it accessible, and you also need to make sure that you're not creating the wheel of things as well, because a separate committee is crazy to me. Mm-hmm. That was never discussed when I went to a first open house. I just got the email a couple days, like 2 days ago. I kid you not. Right. So,
and then we, so she went to the first collaborator meeting, and I couldn't go. I went with her.
I said, you coming?
And I was like, I'm still gonna come, yeah. And so they're like, oh, doulas only, you gotta show your certification, you gotta, register and upload your certification. You gotta upload your certification. That's your RSVP, right? And so I said, well, I have an issue because doulas are great, right? But we're forgetting the entire birth network.
There's a lot more.
And so like what's happening? And so we looked at the people that are in charge at UT over the collaborator and stuff like that. And there's not a nutritionist. There's not a dietitian. There's nobody specific in like postpartum or womb recovery or lactation. And that's very alarming, because if y'all are sitting at this table discussing women's health care,
Also, UT Medical Center is like the #1 hospital in our area.
Yes.
They are the academic hospital.
Can you talk about the insurance?
Oh, we're going to be here for another hour.
No, just talk about
The
what happened, because I
insurance-
need to know.
So, it trickles down.
Right.
Yeah. Yeah. Yeah, the insurance is tricky though, with getting care here in hospital facilities. There is 2 hospitals, UT Medical Center, who has a midwifery practice in it, and then there's only Tenova North, who has a midwifery practice in it as well. And so right now, Tenova, about a year ago, they have switched what they accept in insurance, which made a lot of moms and families have to go to UT.
A lot of black moms.
And go to Fort Sanders. Fort Sanders is right down like on the strip, right off a bus line, so they get majority of the marginalized community. And so it's a real huge issue. And UT has really sparking this doula collaborative, because I have been a doula going on 4 years full time. My first year starting as a doula here in Knoxville, no one knew what the hell a doula was. And so I started making t-shirts. I don't know if y'all see my table out there, but it says Black Doulas Matters. And I started bringing awareness into the community here, specifically on doula care, because no one knew what a doula was. And so I will say that it's a lot more awareness. There's a lot more birth workers coming out the woodworks this past 2 years. But there's still a lot of work that needs to be done. And it's not just specifically for doulas, it's for the whole birth community here, even midwives who are serving here in the community that's inside a hospital or outside a hospital. And so I could say that specifically this bill will push for all. And I just really, really hope and pray that we can unify as a birth community more to, really make an impactful change. So,
do we have any researchers still here?
Mm-hmm.
Okay, anybody from UT or a research institute? Okay, well, I'm going to talk about this because it's important. So if we skip down to number 8, it talks about guidelines for medical research organizations, right? And so there has been a lot of distrust when it comes to medical institutions, particularly hospitals, saying that they would like to collaborate with community and community-based organizations, and then it oftentimes looks like extraction and infiltration, and that research is not owned by the community, right? They just package it up, send it off to the next grant, and then the university gets the money, and it's never returned back to those communities. So shout out to Erin with 3Q, because she does something totally different, which I absolutely love, right? So the research is owned by the community, it's ran by the community, and the community owns it. But this is a very important part of the bill that we wanted to see change. So it says guidelines for medical research orgs to engage meaningfully with grassroots orgs statewide, which must emphasize transparency, shared decision-making, and equitable distribution of resources to maximize the impact of research initiatives on maternal health outcomes. So that means, obviously, that there has to be some type of middle ground, right? So, okay, yes, you can do research, but here are our stipulations, and if you're not going to give back to the communities that we serve, then no, you can't, right? Because when you're doing true community-based work, your clients in your communities are going to trust you prior to anybody else coming into your community, right? Does anybody have any questions on the bill? Do we understand that this is for community-based organizations that typically would not have access to federal funding, state funding?
Oh. You said county or state?
And then, yeah, it's just, we just deal with the direct services of the county as far as like health department. Just local organization, like far as the county commissioner. Yeah. And
they were welcome, they were invited, everybody was invited to co-create with this bill, but they opted out.
No support.
But I mean, as far as funding, I mean,
we appreciate you this year.
I just have like $5,000 to give away, so I gave them $1,000.
Yes.
So
her due diligence, I will say, Senator Becky Massey, she is a senator of Knoxville, and she has co-sponsored the bill as well. So she's a great support. Jeff Yarborough as well.
Yeah, we had a lot of sponsors firsthand when we actually created this bill. We was only up there for 2 days, and we ended up leaving with 2, 3, 4 sponsors on the floor.
From Knox County, like the county government?
No.
It's Daisha. It's a city. It's a city in the city of Knoxville. Yes, they did like the 202 funding. So we were able to tap into that very, very last minute. They gave us a little bit to work with. And then Amelia Parker, councilwoman, she gave some from her.
Allotted money.
You said, did we?
The surrounding counties. No. As a region.
We can. So Alexa and I, we travel a lot outside of Knoxville and Tennessee. So we do have birth worker comrades that we have talked about this bill about. They have showed up for us. We have people from Memphis. I mean, the people here, right, that you have met that aren't even from Knoxville. Those are our people that have really been supporting us, right? But we know birth workers from everywhere. Like, we just went to Georgia for a certification that we got that we're going to demonstrate tomorrow, right? So it's like that type of stuff is really important when you're, when you're doing this work. But, we have support outside of Knoxville too.
We need more support here, though.
Yeah, we do, definitely. Yeah.
Knoxville's waking up slowly but surely.
Child, slow.
We're trailblazers and we're disrupting systems. Remember
I know
that.
that's right. Yes.
Did they just launch it? Yes. We will be tapping into that. I cannot remember, but somebody sent it to me this morning.
Yeah, it just
and
wrote
it's
out.
just one of those things I had to glance at because of this was happening. But yeah, so like that's really important, right? So I'm going to read, but like when it comes to like funding like that, like it's really important to find these money pockets because a lot of people, when you get into birth work, hey Peyton, they try to convince you that everything has to be flipped into a 501c3, right? And that's not totally true. It's just they think that that's where all the money is, and you don't have to do that. Like, you can still run a business. You can have a 501c3 under your business, right? But you have the right to be paid and live sustainably, right? And so we really just want to make a mention that there are alternative payment methods and models. And, we've met with the county, we've met with the city, we've met with the state legislatures, and, we've made a mention like, if you want to close all of these gaps, especially with the social determinants of health, you have to change the payment model. You have to change the philanthropy model. That has to change, right? And it can't be a white savior complex either. Get out of the way. Give these people the money. The report back is you getting your lazy ASS into these communities. That's your report back to see the impact in real time, not me doing a 10-page dissertation on how I serve the community, right? If you want to know how the impact was, go and ask them, because they're going to tell you, and they're not going to lie, right? So just like, that is a great new source of funding, but when it comes with local funding like that, we're crabs in a bucket here, right? So it's going to be a lot of the grassroots community-based organizations, and we've had like this resurgence of over X amount that have developed in the past year, and so there's even more people competing for a very small amount of money, right?
Yep.
Right? Yep. So like I said, it's yeah, exactly.
No.
So why not form camaraderie with other birth workers? Get out of your ego, no matter what you think about the person, y'all all go up for the 100K and you split it. Right? Right? Exactly. So, just coming up with solutions, creative solutions like that, to where, y'all literally stand in solidarity together and just X the middleman out. A great example, the United Way, Kimberly Pettigrew, she is a great comrade. I do not believe in allyship, by the way. Because that's just, it's a slap on the wrist, right? You can kind of teeter that line. Kimberly and United Way does a great job with working with community-based organizations, right? They realize that the impact is a lot greater when you partner and co-create with community-based organizations that have been doing this work for years, right? That community trusts. And your data is also going to reflect more accurately, right? And so United Way does a great job securing funding, but also making sure that everybody gets a piece of the pie, right? And sometimes they have grants to where the requirement is you have to collaborate with another community-based organization. And so that makes a difference. So there has to also be a change in the philanthropy model. The family foundation model, that has to change. But a lot of family foundation models also are waking up when it comes to the distribution of funding. They're actually tired of giving money to these same big organizations that really have not really made a lot of movement compared to like the small guys, right? So.
And that's happening on the county level. They want more collaboration. We don't have our diversity officer anymore, but that was something when you request for funding, they want to know who's partnering with each other, and especially I know with federal grants, they really try to focus on getting Black organizations, and it used to frustrate me because you're only calling me because I'm Black. You don't really want to do the work, so I had to go off on somebody because they just wanted me to have my name on there and not me to be a part of the process of what they was asking for. So. And you would get that a lot, and that's why it gets frustrating and you get tired or whatever. But there's a way that you can still take the money and use your voice. And if they want to do wrong, we have media too. So yeah, you just gotta play the game.
And I've been in that position before, Nasira. I have a lot more no's than I do yeses. And if it's not in alignment and it's not of integrity, I'm not going to do it, right? Because the blowback is real. If it's not with intention, I don't really care for it, right? And if it's not going to benefit the community, I'm really not going to care for it, right? And so I think it's really important to learn how to say no, but also have discernment, but also tax them. So when they ask you, hey, I got $20,000 or I want to do a feature for such and such, you're going to say, no, this is how I want it done. And if you don't want it done like this, respectfully, you can move on. So, there were a lot of news channels, there was a lot of news channels and stuff, right, that wanted to come in. We did email them 6 months ago, 3 months ago, and then last month to follow up and say, hey, this is happening. If y'all want to come in, please do, and we have media passes for you, but instead we went and hired our own media crew, right? And then we get a message yesterday asking for an interview. No, we respectfully decline, right? And so, unfortunately, you have to move like that and set the tone and don't let nobody ever play in your face, right? So, just... So please just just stand in your power and just stay convicted in whatever work you do, right? So even if you're not a birth worker, you make some really great holistic products, right? And so you still have a space and you still have a role in this movement. But, you know, just have discernment and just keep operating in alignment, because the opportunities do get bigger, they do get better, and when they really in alignment, they really hit different. You're welcome. Yeah. It doesn't. Right. Oh yeah, I do NDAs. I do NDAs, my own non-disclosure agreements, but I also ask, like, there's a lot of people that ask, they'll say, me and Alexa say, oh, I want to collab. I want to be a partner. I want a partnership. And I say, okay, well, do you know the difference between a partnership and a collaboration? Because they're not the same thing. Are you benefiting, or am I benefiting, or our communities benefiting? Because depending on that, that's not what this is. But also, I ask, what are your intentions? Like, what are you going to get out of this? Even if you lied to me, I'm going to be able to look you in your eye and know that you're not telling the truth, right? And so you have to have, like, the tenacity to just stand in your power and to really call people out on their BS, but stand in your square and just ask those uncomfortable questions. So what are your intentions? What's your purpose? What's the return on investment? Not for me, but for the people that I serve. And if you're not a servant of the people, still ask, what's in it for me, right? Because a lot of people become extractive in their work. They become manipulative in their work. And it's very important to protect yourself doing any type of business or birth work, right? Like, you're not going to be able to protect yourself from all of these things, right? But it's very important to have as much discernment as you can have when it comes to telling people no. I'm not going to negotiate my worth at all. You can go somewhere else. And I'll give out referrals. I said, this opportunity, thanks, $100,000 is nice, but I have somebody else that you could probably go talk to, and they may say yes. So, you know, it's just stuff like that. So just, you know, I truly believe in operating in alignment and with integrity, because the consequence is really big for people like myself and Alexis, right? Like, it's really different. You know, the work that we do. So, like, any missteps, it could be a huge, like, detriment to ourselves and community. So.
Have y'all worked? Is there any opportunity with Meharry? You know, they do like this Meharry grant. Is that okay?
Yes, so we actually, we sit on the board with the elders, so we do a lot of intergenerational work. That's really important. And so I don't know if y'all saw the elder with the cool African Ghanaian hat on in the all white. That's Elder Umoja. And Elder Umoja, he is great. He is... we sit on the board of the Black Appalachian Healthcare. It's an organization that we formed. And he brought us in on the maternal health side. So it's elders like that are willing to listen, but also see you doing the work that needs to be done, right? And so he had the connection with Meharry Medical. We knew of a community member because I work with a lot of the Muslim community, and so Amir Al-Bawi, he was actually here with Meharry earlier. He'll be here tomorrow, but he approached me actually yesterday, and he was saying, hey, I would like to partner with you guys on some, you know, research that Meharry is doing. It's really important, I know, for us to partner and just have the opportunity to partner with the HBCU, like a Black medical college. Like, that's really big, but it's also something that, you know, we're charged to do that we really want to do. And so, yeah, so that'll be developing soon. We do have, I was about to say that, is Carissa still here? Okay. So Carissa will be here tomorrow. She'll be presenting tomorrow, and we're working. She's out of the University of Mississippi. And funny story, I met Carissa during a food systems conference and fellowship and community advisory board. And so she's a researcher. She's getting her PhD, and she's also a licensed social worker. So please go to her session tomorrow, because we're doing research with her. We're doing a focal group where it talks about Black women postpartum and nutrition. And so we're doing Yeah, we're doing some research on how our clients perceive nutrition during and after pregnancy. And so it's just people like that that you just run into that are already in alignment that typically boomerang back around, or they just stick with you. And that's been really fun. So, you know, I would say to all the birth workers, like, even if you desire to work with a medical institution or a research institution, there are others out there, and it doesn't always have to be local at all. We're actually getting ready we're a part of a book publication, so that'll be coming out in the next few months out of West Virginia. And so there's a lot of work that we're doing in Upper Appalachia as well with West Virginia Public Radio and the journalists up there. It's about medical mistrust. And so Kimberly was there for her interview. I pulled her in, and we talk about medical mistrust and medical apartheid. I talk about food apartheid and nutricide. And so whenever that comes out, I'll let y'all know. But we do have a chapter in that book, and I'm really excited to share that with y'all. So. No, not that, but we talk about medical mistrust and medical apartheid within the Black community. We go into eugenics, all the things. Fast forward to now, we talk about our personal stories and how we got into this work as well. So yeah, it's gonna be really interesting. Okay, anything else before we do our sound healing session? I will say this session will be very powerful. It always puts me to sleep. We did it last year, and Aya will be back. She did the yoga session, and she will be doing the sound healing. If there's no other questions, 5, 4, 3, 2. Okay, we're going to move into the sound healing. So feel free to move these chairs back, and you're probably going to lay on the floor because it's going to take you down. That's how relaxing it is. But feel free to, it took me down. So.
Today, guys, is cool. Cool zone. Cool zone. This is amazing. Really amazing. If anybody comes in here, y'all meet the tower. The big tower. This is like this mic I'm using is it's pretty loud. Can't lie. It's like I don't know. Fortnite Battle Pass. Yes, I do, 'cause I'm the best. Never gonna lose the test. Hello, my fans. If y'all gonna be on YouTube, and I already got me a YouTube channel, so your boy's gonna be in this one. So y'all better look at that video soon. Peace. So here's the final document. Representatives and librarians summarizing its findings and recommendations, which may include recommended legislative or regulative changes to the department for the calendar year. Section 3, Tennessee Code, annotated Section 429, 247 is amended. No, go do the other one. There's another one over there. This is Black's revelation. This is our time to focus.
Here agree. I thank for you to coming everywhere. I know there's not much people. I just want to say this. I couldn't done it without. I could not done anything without Deja here.
For real, guys.
Because
she needs us all.
That's on. Period.
For real.
Okay.
That'll
Thank
be
you.
a good time. Focus on life, everything. You know what I'm saying? Like, see you too. Hey, woo.
Bye, people. Bye, people. Bye, people. It's alive.
The people.
Bye, people. Bye, people. You
the black people,
Yeah,
the black
yeah,
people,
yeah.
the black people,
Oh,
the black people, the black people,
yeah,
the black people, the black people, the black people,
It's
the
the
black
best
people,
day to
the black
become.
people,
It's
the black people, the black people,
It
the
is
black
okay,
people,
but
the
I
black
still
people,
feel
the
like
black
I
people,
have a good
the black
day.
people,
Everything's
the black
about
people,
a good
the black
day.
people,
Everything's
the black
about
people,
a good
the black
day.
people,
I
the
got a
black
dream.
people,
Yeah,
the black
yeah.
people, the black people, the
Yeah,
black
yeah.
people, the black 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 people.